Ancient Egyptian medicine, 3,000 years ahead of its time. Introduction. Imagine a world 3,000 years ago. No modern hospitals. No sterile tools. No antibiotics. And yet the ancient Egyptians performed complex surgeries, set broken bones, prescribed herbal remedies, and even understood how the heart and blood vessels worked, centuries before other civilizations caught up. Today, we'll explore how ancient Egyptian medicine was far ahead of its time, and how their knowledge still influences modern science. Chapter 1. The Foundations of Egyptian Medicine. Ancient Egyptian medicine stood on a remarkable balance of science, observation, and spirituality. They believed that health was a gift from the gods and that sickness could be caused by curses, spirits, or the wrath of deities. Yet, they didn't rely on magic alone. They observed, documented, and experimented, creating one of the most advanced medical systems of the ancient world. One of the best pieces of evidence is the Edwin Smith Papyrus, dating back to around 1600 BCE, but likely copied from texts over 1,000 years older. This incredible document is often called the world's first surgical manual. It includes over 40 detailed case studies on wounds, fractures, and head injuries. Sats, instructions for diagnosis and prognosis, such as determining if a patient would recover, need long-term care, or could not be saved. Techniques for suturing wounds and immobilizing broken bones. Recommendations for cleaning wounds with honey and resin to prevent infection. Another crucial text, the Ebers Papyrus, is a massive scroll over 20 meters long, filled with 700-plus remedies and recipes for everything from digestive disorders and skin conditions to mental health issues. It even references what could be considered early contraception techniques using honey and acacia. Priest-physicians known as Sunu were trained specialists. They didn't just memorize remedies, they kept medical records, shared knowledge, and even specialized in certain areas like dentistry, surgery, or eye diseases. And while spirituality was woven into their practice, with spells and prayers often accompanying treatments, the Egyptians' ability to observe patterns, record symptoms, and apply practical solutions made their medical practices astonishingly effective for their time. This combination of faith, logic, and experimentation set the foundation for all other ancient medical traditions, from Greece to India. Chapter 2. Surgery and Bone Setting. Ancient Egypt wasn't just advanced in theory, they were remarkably skilled surgeons for their time. Archaeological and textual evidence shows they performed procedures that wouldn't be fully understood in Europe for over 1,000 years. The Edwin Smith Papyrus provides a window into their surgical expertise. It describes techniques for stitching wounds using linen threads or plant fibers, cauterizing injuries with heat to stop bleeding, and cleaning wounds with antiseptic mixtures of honey, resin, and sometimes copper salts, ingredients we now know have antibacterial properties. Immobilizing broken bones with splints made from wood, linen, or bark, held in place with bandages soaked in gum or resin. Skeletal remains found in tombs and burial sites tell the same story. Scientists have discovered healed fractures that were properly aligned, suggesting that patients not only received bone-setting care, but survived and healed well. In some cases, the precision of the bone-setting rivals basic modern orthopedic practices. There's even evidence that Egyptian surgeons understood the importance of hygiene and infection control, something many later civilizations ignored. Wounds were often treated with honey, which acts as a natural antiseptic, and bandages were changed regularly to keep the area clean. While they didn't perform invasive internal surgeries, partly because of the religious taboo around cutting open the body, their ability to handle external injuries, broken bones, and even head trauma made them some of the most advanced trauma doctors of the ancient world. These methods weren't reserved only for pharaohs or the wealthy. Common laborers, including pyramid builders and field workers, often received the same level of care, showing that medicine in Egypt was surprisingly accessible compared to other ancient cultures. Chapter 3. Herbs, Drugs, and Natural Remedies. If there was one area where ancient Egyptian medicine truly shined, it was their knowledge of herbs and natural compounds. For over 3,000 years, they documented and refined remedies, many of which modern science now recognizes as effective. The Ebers Papyrus, dating to around 1550 BCE, lists more than 700 treatments using over 400 different plants, minerals, and animal products. Many of these remedies have surprisingly modern applications. Honey, applied to wounds to prevent infection, thanks to its natural antibacterial properties. Modern hospitals still use medical-grade honey for the same reason. Garlic and onions, prescribed for heart health and circulation, echoing what cardiologists recommend today. Aloe vera, used to soothe burns and skin irritations, just like in modern creams and gels. Castor oil, taken as a laxative and used to treat skin problems. Frankincense and myrrh, used for anti-inflammatory and antiseptic purposes. These resins are still studied for medicinal properties today. Acacia, mixed into honey to create a spermicidal paste, showing an early form of birth control. What's remarkable is that these remedies weren't just trial and error. Egyptian physicians often observed patterns, documenting which treatments worked best for certain conditions, and refined their recipes over generations. They also used natural minerals like natron, a type of salt, for drying wounds and preventing infections, a technique that may have inspired its use in mummification. Interestingly, some treatments show their spiritual side too. Alongside the physical remedy, doctors would often recite a spell or prayer to invoke divine assistance. While we might see that as superstition today, it likely offered patients comfort and possibly boosted recovery through the placebo effect. Modern researchers have found that many of these ancient formulas genuinely had antibacterial, anti-inflammatory, or pain-relieving properties. This balance of observation, experimentation, and a little divine faith made Egyptian medicine one of the most effective systems of the ancient world. Chapter 4. Dentistry and Eye Care. The ancient Egyptians weren't just pioneers in surgery and herbal medicine, they also made impressive advances in dentistry and eye care, fields that were centuries ahead of their time. Dentistry. Treating the pain of the Nile. Life along the Nile often meant a diet full of stone-ground bread that contained tiny bits of sand and grit. Over time, this wore down teeth, causing painful cavities, infections, and abscesses. To combat this, Egyptian physicians developed some of the earliest forms of dental care. Core tooth cleaning powders made from crushed eggshells, pumice, and myrrh to clean teeth and freshen breath. And filling techniques where cavities were packed with herbal mixtures or resins to relieve pain. Splints for loose teeth, using linen or wire to stabilize them, a primitive version of modern dental braces. And in extreme cases, if a tooth was beyond saving, they likely attempted tooth extraction. Archaeological evidence even shows that some individuals had drilled holes in their teeth to drain abscesses, an excruciating but life-saving procedure. Eye care, healing the windows of the soul. The harsh Egyptian sun, desert dust, and bacteria from the Nile often led to eye infections and irritations, which were common in all classes of society. To treat these, Egyptian healers developed a range of eye remedies, honey and milk drops to reduce infection and soothe inflammation. As green malachite paste applied to the eyelids, which not only looked cosmetic, but may have had antibacterial properties. Kohl eyeliner mixed with lead salts, which scientists now believe helped prevent certain bacterial infections. Treatments for serious conditions like trachoma or cataracts, using herbal rinses and poultices. What's striking is how holistic their approach was. Eye ailments were often treated alongside spiritual incantations, calling upon gods like Horus or Hathor, protectors of healing and vision. Modern researchers studying these remedies have found that some of these mineral compounds actually stimulate the immune response, meaning these ancient treatments had real medicinal benefits, even if the healers didn't fully understand the chemistry. Chapter 5. Understanding the Body. One of the most remarkable aspects of ancient Egyptian medicine is their early attempt to understand human anatomy. While their knowledge wasn't as advanced as modern science, their observations were surprisingly accurate for a civilization that existed over 3,000 years ago. Knowledge from mummification. Through the process of mummification, embalmers gained unique insights into the structure of the human body. They observed organs like the liver, lungs, stomach, and intestines, even if they didn't fully grasp their functions. For example, they knew the heart was central to life and believed it pumped a vital life force called Ka. They documented the brain but thought it was less important, often removing it during embalming. They noted the presence of blood vessels and channels, which they believed carried air, blood, and mystical energy throughout the body. Medical texts and observations, papyri like the Edwin Smith papyrus, dated to around 1600 BCE, reveal an astonishingly rational approach. It describes 48 case studies of injuries, from skull fractures to spinal trauma, showing they could diagnose injuries based on symptoms and differentiate between treatable and untreatable cases. He apply splints, dress wounds, and even attempt to prevent infections. This makes the Edwin Smith papyrus one of the earliest examples of scientific observation in medicine, moving away from purely magical explanations. Holistic theory. Egyptians believed the body contained a series of channels, or metu, that could be blocked or imbalanced, leading to illness. To open the channels, they used herbal purges and enemas, bloodletting in rare cases, diet adjustments to restore balance. Although their understanding of anatomy and physiology was limited, this channel theory laid a foundation for later concepts in Greek and Roman medicine, and even has parallels in modern ideas of circulation. Evidence in practice. Skeletal remains and preserved mummies show that many Egyptians survived complex injuries and surgeries, proving that their practical knowledge of the body allowed them to treat conditions far better than many other ancient cultures. Chapter 6. Legacy and Influence. The impact of ancient Egyptian medicine didn't fade with the fall of their civilization. Instead, it became the foundation of medical knowledge for centuries to come. Influence on Greek and Roman medicine. When Greece rose to power, scholars like Hippocrates, often called the father of medicine, drew heavily on Egyptian texts and practices. Greek physicians studied in Egyptian temples, particularly in the great medical schools of Heliopolis and Memphis. Later, the Romans inherited and expanded on this knowledge, spreading it across their empire. Many concepts we take for granted, such as cleaning wounds, using natural remedies, and observing symptoms before diagnosis, can trace their roots directly back to Egypt. Even the Hippocratic Oath, which emphasizes ethics in medicine, echoes the spiritual and moral duties outlined by Egyptian healers thousands of years earlier. Preservation of knowledge. The famed Library of Alexandria stored countless Egyptian medical papyri, helping preserve and spread their wisdom. Although much was lost when the library was destroyed, fragments and translations found their way into Greek and Arabic medical texts. During the Islamic Golden Age, scholars like Avicenna and Al-Razi referenced Egyptian principles while compiling their own medical encyclopedias, ensuring that this ancient knowledge continued to influence medicine well into the Middle Ages. Modern resonance. Even today, modern science validates many of their practices. Honey is used as an antibacterial treatment. Willow bark, which Egyptians used for pain relief, is the basis for aspirin. Proper wound cleaning, emphasized in papyri, remains a cornerstone of basic medical care. A lasting symbol beyond the science, Egyptian medicine symbolizes the human quest for understanding and healing. Their blend of careful observation, practical solutions, and spiritual belief shows that medicine is not just about curing the body, but also comforting the mind and spirit. Their legacy reminds us that what we call modern medicine is really the latest chapter in a story that began thousands of years ago along the banks of the Nile. The story of ancient Egyptian medicine reminds us that human curiosity and the desire to heal are timeless. From the banks of the Nile to the hospitals of today, their knowledge continues to inspire. If you enjoyed this journey into the medical marvels of the ancient world, like, subscribe, and share for more hidden histories from Egypt.